Okay, essential screening for anyone age 50 and beyond. Now you just turned 50 and you're wondering what some of the medical things that you need to do to keep your health at bay, or to keep your health, keep yourself healthy. Now, the first thing you want to do is cancer screening, colon cancer screening. Usually it starts at age between 45 to 50, depending on your risk factor. And what you got to do is schedule a colonoscopy every 10 years. If you don't have access to colonoscopy, you can do the fecal test, which is done annually, or stool DNA, or sigmoidoscopy. Okay, one of these are good so that we can detect colon cancer early. The next one, if you're a woman between age 40 to 50, you just get a mammogram every 1 or 2 years because early detection of breast cancer is very important. Number three, prostate cancer. For men, screening start at age 50 or 45. You have a higher risk, especially African Americans or African descent. You must start early. And the test you do is a digital rectal exams that is done by your primary care doctor. And if they detect something unusual, they'll send it to the urologist. They can do a PSA blood test as well, but you have to combine both PSA and the digital rectal exam. Don't do PSA independently. You might wrongly interpret it. Because early detection of prostate cancer is very important. Number four is bone density scan. Bone density scan. When do you start that? Starting at age 65 or younger if you're at risk. If you're a woman, a man after age 70 or earlier if you're at risk. And the reason is to detect osteoporosis and to prevent future fractures. Number five, if your cholesterol check. Frequency, how frequent would you do that? Every 4 to 6 years, or more often if you're at a high risk or you have strong family history. Number six is blood pressure check, very important. Frequency at least once every month. The literature might tell you maybe once a year, but that is not enough. Once every month is good. And if you have blood pressure that is very high on three consecutive check-in, then you need to see a provider to be able to manage your blood pressure with either lifestyle modification or medications if needed. The next one you need to check is diabetes screening. When do you start? Well, between ages 35 to 45. You need to check your fasting glucose, or what we call hemoglobin A1C. And you can repeat this every 3 years, more often if you're overweight and you also have a high risk. Now that we have a pandemic of type 2 diabetes because of people are putting a lot of weight. Actually, if you're overweight, you should check it earlier than age 50, 35. Early detection of diabetes help with management and complications. Number eight, eye exam. How frequent you check your eyes? 1 to 2 years is fine. Why do you do that? To early detection of glaucoma, cataract, or macular degeneration. And if you're diabetic never retinopathy is very important. If you're diabetic, you check it every year. So that you can early detection of diabetic retinopathy is very important. Number nine, hearing test. When do you start? Well, age 50 and above as needed. If you notice that you're having a hearing loss, then I think it's a good idea to check it earlier. And number 10, last but not the least, is your skin check to detect skin cancer. The earlier you check it, the better. Do it annually or more frequent if you're at risk. If you're a fair skinned person and you are on the sun all the time, they should check it early. So I hope this was very helpful to you. Come back here for more weekly tips about your health. Remember, 21st century, you're on your physician. And so Dr. Fraser, and I'll see you on the next episode.